Hi friends, welcome to the channel The Nurse. Here we are discussing about RRB Staff Nurse Exam 2019 Practice Questions and Answers with Rationale. If you are not subscribed to our channel, please subscribe. And question starts now. First question. When taking client's apical pulse, where should the nurse place the stethoscope? Just left to the median point of the sternum, in the fifth intercostal space at this left midclavicular line, between the sixth and seventh ribs at the left midaxillary line, between the third and fourth ribs and to the left of the sternum. Correct answer is in the fifth intercostal space at the left midclavicular line. The heart's apex is between the fifth and sixth ribs at the midclavicular line. It is closest to the chest wall here, so auscultation is easier. Next question. The nurse is caring for a preschool age child with a history of physical and sexual abuse. What is the most advantageous therapy for this child? Play, group, family, psychodrama. Correct answer is play. Play is the most effective method for the child to play out feelings. When feelings are allowed to surface, the child can then learn to face them by controlling, accepting or abandoning them. Next question. After open heart surgery, a client develops a temperature of 102 degree Fahrenheit. The nurse notifies the physician because elevated temperatures increase cardiac output, may indicate cerebral edema, are likely to lead to diaphoresis, may be a forerunner of hemorrhage. Correct answer is increase cardiac output. Temperature of 102 degree Fahrenheit or greater led to an increased metabolism and cardiac workload. Next question. When planning activities for a child with autism, the nurse must remember that autistic children respond best to large group activity, loud cheerful activities, individuals in small groups, their own self-stimulating acts. Correct answer is their own self-stimulating acts. The autistic children do not respond to the environment but attempt to maintain emotional equilibrium by rubbing and manipulating themselves and displaying a compulsive behavioral repetition. Next question. What should the nurse identify as the primary cause of the pain experienced by a client with coronary occlusion? Arterial spasm, ischemia of the heart muscle, blocking of the coronary veins, irritation of the nerve endings in the cardiac plexus. Correct answer is ischemia of the heart muscles. Ischemia causes tissue injury and the release of chemicals such as bradykinin that stimulates sensory nerves and produce pain. Next question. The nurse understands that in the absence of pathology, a client's respiratory center is stimulated by oxygen, lactic acid, calcium ions, carbon dioxide. Correct answer is carbon dioxide. The respiratory center in the medulla responds primarily to increased carbon dioxide concentration in blood. Next question. When assessing for complication of hyperparathyroidism, the nurse should monitor the client for which response? Tetany, seizures, Graves' disease, Bone destruction. Correct answer is bone destruction. Hyperparathyroidism causes calcium release from the bones, leaving them porous and weak. Next question. What clinical indicator should the nurse expect to identify when assessing an individual with spontaneous pneumothorax? Hematemesis, unilateral chest pain, increased thoracic motion, mediastinal shift towards the involved side. Correct answer is unilateral chest pain. Sudden chest pain occurs on the affected side. It may also involve the arm and shoulder. The mediastinal shift towards the unaffected side results from pressure from the pneumothorax. Next question. Identify the part of human stomach which connect or joins with the esophagus. Fundus, cardia, body, pylorus. Correct answer is cardia. The 5 parts of stomach are: first, cardia. The first part is closest to the esophagus. Next, fundus, the upper part of the stomach next to the cardia. Third, body or corpus, the main part of the stomach between the upper and lower parts. Fourth one is antrum, the lower portion near the intestine where the food mixes with the gastric juice. Last one, pylorus, the last part of the stomach which acts as a valve to control emptying of the stomach contents into the small intestine. Next question. What is gout? A degenerative disease, vascular disease, renal disorder, metabolic disorder. Correct answer is degenerative disease. Gout is a form of arthritis caused by excess uric acid in the bloodstream. The symptoms of gout are due to the formation of uric acid crystals in the joints and the body's response to them. Gout most classically affects the joints in the base of the big toe. Next question. Which one of the following is infectious hepatitis? Hepatitis A, hepatitis B, hepatitis C or hepatitis D? Correct answer is hepatitis A. Hepatitis A is known as infectious hepatitis. Hepatitis B is known as serum hepatitis. Hepatitis D is known as delta hepatitis. Next question. Which of the following medicine is necessary for pregnant lady? Tetanus, BCG, rubella, DPT. Correct answer is tetanus. According to WHO, if a pregnant woman has not previously been vaccinated or if her immunization status is unknown, she should receive 2 doses of a tetanus toxoid containing vaccine or TT 1 month apart with the second dose given at least 2 weeks before delivery. 2 doses protect against tetanus infection for 1 to 3 years in most peoples. A third dose is recommended 6 months after the second dose, which should extend protection to at least 5 years. Next question. What is the chemical name of aspirin? Acetyl salicylic acid, acetyl salicylic acid, acetone salicylic acid, amide salicylic acid. Correct answer is acetyl salicylic acid. Aspirin or acetyl salicylic acid is a commonly used drug for the treatment of pain symptoms due to various causes. Acetyl salicylic acid has both anti-inflammatory and antipyretic effects. This drug also inhibits platelet aggregation and is used in the prevention of blood clots and myocardial infarction. Next question. First tool of the neonate is called sebum, lanugo, meconium, vernix gaseosa. Correct answer is meconium. Meconium is the earliest tool of the newborn. Unlike later feces, meconium is composed of materials ingested during the time of the infant spent in the uterus. Intestinal epithelial cells, lanugo, mucus, amniotic fluid, bile and water. Next question. Which one of the following is poor man's meat? Milk, fish, pulses, chicken. Correct answer is pulses. Next question. Which of the following test is used to detect typhoid bacillus? VDRL, Vidal, BCG, UDRL. Correct answer is Vidal. The Vidal test is one method that may be used to help make a presumptive diagnosis of enteric fever, also known as typhoid fever. Next question. Rice water stools is a symptom of dengue, malaria, cholera, typhoid. Correct answer is cholera. Diarrhea due to cholera often has a pale, milky appearance that resembles water in which rice has been rinsed. Next question. Wilms tumor affects which of the following? Liver, bladder, skin, uterus. Correct answer is bladder. Next question. Thalassemia is congenital, defects in bones, blood disorder, neural defects, muscular defect. Correct answer is blood disorder. Thalassemia is a blood disorder passed down through families in which the body makes an abnormal form or inadequate amount of hemoglobin. Next question. Which one of the following blood group is universal recipient? O, A, AB group or B group? The correct answer is AB group. In transfusions of packed red blood cells, individuals with type O RHD negative blood are often called universal donors. Those with AB RHD positive blood are called universal recipients. Next question. Bulimia nervosa and anorexia nervosa are sleep disorder, eating disorder, mental disorder, none of these. Correct answer is eating disorder. Bulimia nervosa. It is an eating disorder characterized by binge eating followed by purging. Binge eating refers to eating a large amount of food in a short amount of time. Purging refers to the attempts to get rid of the food consumed. This may be done by vomiting or taking laxatives. Where anorexia nervosa means it is an eating disorder characterized by weight loss or lack of appropriate weight gain in growing children. Difficulties maintaining an appropriate body weight for height, age and stature, and in many individuals distorted body image. The question ends here, and thank you for watching this video. Please like and share this video and don't forget to subscribe this channel, The Nurse. Thank you.